Hello everyone, this is Dr. Ahmad, and today we are going to learn about the second part of the cerebral cortex. Please review the first part so you can understand the major lobes of the cerebrum and also to see what are the primary motor or the sensory areas that are associated with it. Here we are going to learn about the circle of Willis, the saccular aneurysm, anterior and posterior blood supply of the cerebral cortex. So the very first thing that we are going to learn for the blood supply is the circle of Willis. The circle of Willis encircles the pituitary stalk and it provides the important communication between the forebrain and the hindbrain. So there are two major components of the circle of Willis. The first one is the internal carotid arteries and the second one is the vertebral arteries. So the anterior circulation to the brain is provided by the internal carotid arteries, and the posterior circulation to the brain is provided by the vertebral arteries. So here we are going to look at the circle of Willis, and I want you to pay attention here because it gets a little bit of complicated. So let's start from the bottom. So you see here that there are two vertebral arteries. These are the paired arteries. So they come here in conjunction on each side of the vertebrae. So the very first branch that it gives out is the posterior inferior cerebellar artery. And the occlusion or the syndrome that it may cause, it is called as the lateral medullary or the Wallenberg syndrome. And another artery that gives rise that gets rise from the vertebral artery is the anterior spinal artery, and it can cause the medial medullary syndrome. So you see both of these vertebral arteries are converging at this point, and at this point it makes the basilar artery. The very first branch that actually gives out from the basilar artery is called the anterior inferior cerebellar artery, and occlusion in these arteries can cause the lateral pontine syndrome. So you remember posterior inferior cerebellar artery is through the vertebral artery. When it combined here to make a basilar artery, the first branch that it gives out is the anterior inferior cerebellar artery. Further ascending on the basilar artery, you see these little branches that are given out, and these branches are called the pontine arteries, and they supply to the pons. And any of the occlusions here can cause the locked in syndrome. So over here you see the basilar artery is going to give two more branches on the either side, and these are the superior cerebellar arteries. So you see that most of the cerebellum is supplied by the vertebral arteries and the basilar arteries. Pontine arteries are also coming out for pons. Now you see over here, basilar artery actually bifurcates on each side, and it gives rise to the posterior cerebral artery, not cerebellar, I'm sorry, it's posterior cerebral arteries. So both of the posterior cerebral arteries are connecting with the internal carotid arteries on each side via posterior communicating arteries. You see a branch coming out of the internal carotid artery. This is called as the anterior choroidal arteries on both ends. Now you see here is the anterior cerebral arteries, and the anterior cerebral artery is communicating or connecting with the internal carotid artery via anterior communicating artery. So that makes the entire circle of Willis. So as you see here in the circle of Willis, this part over this line, so let's make a division right here. It's basically the internal carotid artery making the entire circle, and below here is actually made up with the vertebral arteries, which combines and then bifurcates further. So this is one of the images or the MRA of the circle of Willis. You cannot see the entire thing here. You see the internal carotid artery, you see the middle cerebral artery and anterior cerebral artery, and the basilar artery right there. So what is a saccular aneurysm? For that, we need to understand what is this aneurysm is. So these are the dilatation of the arteries along the points of the weakness in the brain. The majority of these aneurysms are berry or saccular in nature and present in the anterior circulations or the circle of Willis. So most of these aneurysms are present in the circle of Willis. So they are present at the junctions of the different arteries in the circle of Willis. Most of these aneurysms are asymptomatic if they stay unruptured. However, if the aneurysm can get bigger and bigger, it may compress the surrounding brain tissue and may cause any symptoms. But if they rupture, they can cause the subarachnoid hemorrhage. So let's look at this diagram right here. Again, this is the circle of Willis right here. You see the basilar artery, which originates from the vertebral arteries, and you see all the major communicating point here. This is the internal carotid artery. So 40% of the aneurysm happens at the junction of the anterior cerebral artery and the anterior communicating artery. So you remember these are the anterior cerebral arteries right there, and these two are the anterior communicating artery. So at the junctions of this can cause an aneurysm, which makes up the 40% of the total number of arteries, not total number of aneurysms. The second type of aneurysm can be caused 34% at the bifurcation of the middle cerebral arteries. So you see the middle cerebral artery, it arises from the internal carotid artery, and you see here that there at 34%, if the middle cerebral artery is bifurcating here, 34% of the aneurysms are caused at this junction. The uh, third one on the list is the 20% at the junction of the internal carotid arteries and the posterior communicating arteries. Again, this is the internal carotid arteries on either side, and this is the posterior communicating artery. 20% happens right here. And coming forth is 4% at the bifurcation of the basilar artery. So once again, when the basilar artery is actually bifurcating to give rise to posterior artery and having a communication with the posterior communicating artery, 4% of aneurysms happens right here. So this is some of the examples of the saccular aneurysm. You see this balloon shape artery dilatation right here. This is one of the examples, one of the real images that you can see. It's right here. And on the MRA, it kind of look like this. So let's look at the major blood supply of the cerebral cortex. So it is it is done through the anterior, middle, and the posterior arteries of the cerebral cortex. So these are the three major arteries that actually supplies. And now we are also going to look at the internal capsule and discuss the watershed territory. So anterior cerebral artery, you see here, it is originating from the internal carotid artery, and then it goes on the medial aspect of the cerebrum. Anterior cerebral artery will extend superior or above the corpus callosum, and then it gives out to the branches to the superior aspect of the cerebrum. But you have to understand that this anterior cerebral artery is gonna supply medial parts of the different lobes of the brain. So the areas supplied by the ACA or the anterior cerebral arteries include the medial frontal and the medial parietal lobes, the anterior limb of the internal capsule, and the majority of the corpus callosum. The next one is the middle cerebral artery. Remember that, remember your anatomy from the Circle of Willis. One of them is the middle cerebral artery. The middle cerebral artery supplies to the lateral frontal and the lateral parietal lobes, the genu and the posterior limb of the internal capsule. We're going to discuss the internal capsule in the coming slides. And most of the basal ganglia is supplied by the middle cerebral arteries. You see here, this is the lateral side of the brain. So since middle cerebral artery is mostly going to supply the lateral part of the cerebrum, the medial part of the brain or the medial part of the cerebrum is supplied by the anterior cerebral artery along the lines of the corpus callosum. The lateral part is going to be supplied by the middle cerebral artery. The last one is the posterior cerebral artery, and it supplies mostly to the inferior and the posterior part of the cerebrum. So posterior cerebral artery supplies less to the lateral side and more on the medial side. So it's going to supply most to the occipital lobe, portion of the temporal lobe, and the midbrain. So another thing that we have to remember is the homunculus. Homunculus is very important. You do remember from the first part of the cerebral cortex, homunculus is present on the either side of the central sulcus. Anterior to the central sulcus, it is the motor homunculus. Posterior to the central sulcus is the sensory homunculus. So you see here, both of the homunculus are present here. This one is the motor one, and this one is the sensory one. So let's look at, this is the color coded ones. So let's see, anterior cerebral artery, this color right here, it is just providing the blood supply to the medial aspect up till right here to the trunk. So starting from genitals, toes, ankles, knees, hip, and trunk is basically supplied by the anterior cerebral arteries on both sides. So basically both the sensory and the motor homunculus are supplied by the part of this is supplied by the anterior cerebral artery. The second one is the middle cerebral artery. Remember this color? You see these colors right here. So the major part of the cerebrum, or the major part, another major part of the homunculus is supplied by the middle cerebral artery. So starting from the shoulder, elbow, and then going all the way down to the swallowing portion, which is basically the larynx. And on the sensory side, you see all these to the intra and intra-abdominal pharynx. So these are the ones that are supplied by the middle cerebral arteries. Now, why is it important? uh, you see here, as I explained before, this is the central sulcus, motor cortex, and the sensory cortex, motor one and the sensory one. Motor one present in the frontal lobe, sensory one present in the parietal lobe. Now, why this is important? So the paralysis of the different part of the body, either motor or the sensory one, whichever one is involved, the understanding that where the paralysis is present, you can actually try and pinpoint the pathology or the stroke that is present. And you can actually try to pinpoint from your clinical findings that where the stroke could be present and which area of the arteries are basically involved. So let's see the internal capsule and its blood supply. First of all, we're going to have to establish what is the internal capsule. So internal capsule is a white matter structure which is situated in the inferior medial part of each cerebral hemisphere, and it carries information past the basal ganglia, separating the caudate nucleus and the thalamus from the putamen and the globus pallidus. And it has three portions: anterior limb, genu, which is a bend, and the posterior limb. So let's look here. This is the internal capsule right here in the brain, and it has a unique location where a large number of motor and sensory fiber they travel to and from the cortex, from the cerebral cortex. And damage to the area can cause the unique findings which make it possible to localize the lesion with the physical exam alone. So let's see. So this is the medial part of the cerebrum, and then it goes down laterally. So again, this is basically, just imagine the homunculus right here. So you start with the toes, ankles, knees, hip, and trunk. After that, the upper limb starts. So shoulder, wrist, fingers, and then you go all the way up to the neck, eyelids, nares, lip, tongues, and larynx. So these ones are going to be coming through this through the through the internal capsule. So you see, this is the anterior portion, the bend is the genu, and this one is the posterior limb. So leg, trunk, arm, and face, all of the sensory and motor are going to go through there. So internal capsule is supplied by two major arteries. One is the anterior cerebral artery, which is supply which will supply the anterior limb, and the genu and the posterior limb are supplied by the middle cerebral artery. So once again, let's look at the diagram right here. So the anterior cerebral artery is supplying the anterior limb, genu, and the posterior limb is being supplied by the posterior cerebral arteries. Now you see here that not most of these parts, or the sensory one is not supplied here with the anterior cerebral artery, but mostly are present with the middle cerebral arteries. So if there is a problem with one of these places, if there is any occlusion in the middle cerebral artery, you will see the symptoms in all of these places right here. If there is a problem with the anterior cerebral artery, you don't see any problems with the internal capsule right there. So on the last slide, we will understand the watershed territory. So what is a watershed territory? So these are the border zone regions in the brain which is supplied by the major cerebral arteries, which is usually two arteries, and it can involve either anterior cerebral arteries, middle cerebral arteries, or the posterior cerebral arteries. So let's look at the a section of the brain right here. So you see the cerebrum right here. This is the basically the medial part of it. This is the lateral part, superior and everything. So this is the ACA, or anterior cerebral artery territory. This is the middle cerebral artery territory, and this is the posterior cerebral artery territory. So both of them extend their branches right here, but this is the watershed territory where both of them actually going to give their branches over here. But sometime it has a problem and there is no driving force over there. So this area is of a concern because it comprises at least 10% of all the ischemic strokes. So this is one of the watershed territories here between ACA and MCA, and this one right here is a watershed territory between PCA and the MCA. So with this slide, we are going to end our presentation. Please follow for more. Thank you so much, and I'll see you soon.